Good morning. I am Ashley James from Good Morning Maryland, and we are live with GBMC's Dr. Jennifer Heller as we discuss veins and venous issues. So ask us your questions, and if you've joined us here before, you know how this works. This is a very that you've been sitting there thinking, I've been meaning to talk to a doctor about this. Well, now we have one from GBMC or from the Vein Center at GBMC, and this is a really big topic. A lot of people have a lot of questions about this. Does it affect mainly women, or do you see some men too in there?
Well, good morning, and everyone, thank you for tuning in. It's a pleasure to be here. Vein disease tends to affect both women and men, but it tends to predominate in women. And the reason for that actually has to do with hormonal balances, particularly the hormone progesterone. So some risk factors for development of vein disease include being female and multiparity, which means having multiple pregnancies.
Okay.
And those are two very big risk factors for development of venous disease. In addition, heredity plays a big role. So both female and men can come in and say, oh gosh, my grandparents and my mother and my uncle all had vein disease, and did they really give it to me? And indeed it's true, they did.
All right, well, we want to give people a second to tune in here. We see we have some folks on there now. I'm going to be looking at my phone, so feel free to write in your questions. I'll look down here, and then I'll give the question to Dr. Jennifer Heller again from GBMC. So we did have some people write in some questions for us, and so I want to get straight to those. Okay, so somebody wrote in, how do I know if my veins need to be treated?
That's really an excellent question. Just because someone has varicose veins doesn't necessarily mean that they need to be treated. And in fact, visually, varicose veins can be visually alarming perhaps, but in actuality, if they're not causing any symptoms, then they don't need to be treated, and that's the gold standard. We have a few main societies within the United States that are both nationally recognized as well as internationally recognized, and a group of us have come together and looked at data from published studies clinically as well as basic science, and realized that if veins don't bother you, they don't cause symptoms, there's absolutely no indication for intervention.
When you talk about symptoms, what could those symptoms be?
So if I could backtrack just a bit, we have two kinds of tubes in our body that carry blood. Arteries and veins. Our arteries bring blood down from our heart, but our veins actually have a more difficult responsibility because they need to bring our blood back up to our heart against gravity. And the way that they do that are with little structures in them called valves. So if this is a vein, the valves actually propel the blood up, and then most importantly, they need to close. If those valves don't close, the blood, when our legs are down or in the dependent position, fall into our legs. So symptoms associated with that extra pooling or extra venous blood in your leg are what we're looking at, meaning heaviness of the legs, fatigue, sometimes over the course of time, itching can develop, warmth over bulging varicosities, and in advanced cases, wounds or venous ulcers can develop.
Okay. Is there anything I can do to prevent vein disease? You talked about it, in some cases, it's hereditary?
Mm-hmm. Yes, of course we can't remove the hereditary aspect of it, but I always tease my patients that, if they got their varicose veins from their mother, that...
Blame her.
Exactly. That's the time to do it.
She has to pay the bill.
That's right. Staying active is very helpful because as we flex, you can even try this as you're watching, as you bend your ankle, you're actually feeling your calf muscle tighten, and that helps the calf muscle propel the vein blood up. So that is very good. So any kind of exercise where you're activating that ankle and that calf muscle pump is great. Being slender also helps because extra weight does tend to exert extra force on the veins in our legs. There are a lot of lotions and potions out there, and unfortunately they have not proven effective.
Really? Okay. I always heard the myth, when you cross your legs.
No, cross away.
Cross away. There's no truth to that. Oh my
really
gosh,
isn't.
it took me so long to figure that out. All right, well, I have to blame my mom for probably passing that down to me, right? Do you hear that a lot?
Yes.
Yeah. All right, well, we got that out of the way. Okay, so is vein treatment painful? And I guess to elaborate, what are some of the treatments that are out there and available?
Vein treatment has really been revolutionized. About 15 years ago, we mainly got away from the typical vein stripping, which a lot of the viewers today are probably aware. People would go into the hospital, they'd have general anesthesia, and the vein would literally be pulled out. It was a barbaric procedure for surgeons, for us. and patients took a really long time to recuperate because it was a very vigorous, aggressive surgery. And it was also associated with some significant nerve complications. So the good news is that vein stripping is now basically been abolished and should be. And the standard of care are now minimally invasive procedures. And they involve either, instead of pulling the vein out of the leg, we go inside the vein and heat it shut. And so we can do that with a variety of different techniques. We could do it with laser heat or radiofrequency heat. We could do it with now glues and different kinds of foams. So we have a lot of different exciting techniques that are all used in a variety of different ways depending on patients' vein problems.
Will the issue ever come back?
That's a very good question. Vein disease does tend to be chronic. However, it does take a long time for that to recur.
Okay. And in some of the procedures you're talking about, what is the recovery like, the recovery time?
It is an outpatient procedure. There are some centers that perform these procedures in the office. At GBMC, at the Vein Center, we perform them in the surgical outpatient center. I just feel it's more patient preferable. And the patients go home within a couple of hours. They're able to walk that day. They don't need narcotics, and they're up and about walking. In fact, I require them to be walking that day.
Okay.
So it's very quick recovery.
All right, if you're just joining us, we were talking about veins and venous issues with Dr. Jennifer Heller from the Vein Center at GBMC. So go ahead, write in your questions. Again, we had some questions submitted to us earlier, so we keep asking away, but we want to hear from you. Okay, so we talked about the symptoms, what typically brings patients to seek vein treatment. Can you go over some of the symptoms again for those just joining us?
Sure, absolutely. So again, if your veins aren't working, they tend to create extra vein blood in your legs. So heaviness, aching, fatigue. Over time, you could develop, in those bumpy or bulging varicose veins, you could develop warmth or itching perhaps over those varicosities. Some patients will also notice intuitively that they'll say, gosh, my legs feel so heavy, I'm just going to raise them up. And that immediately will alleviate the discomfort. Vein disease is not an excruciating pain. It tends to be almost like an early toothache, that you feel that it's a little bit uncomfortable, and it's not horrible, but it's just uncomfortable, and it's limiting you from doing what you'd like to do.
Yeah, what are some of the long-term problems that it can lead to?
So over time, what happens with these veins is if you can think of a balloon that you blow up and then you let the air out of the balloon, that balloon never goes back to its original shape. And so the veins are very similar to that of an elastic balloon, and so they gradually dilate over time. And what can happen is that they can develop new branches, and those branches become inflamed and sort of angry that there's extra blood sitting in them, and that can cause something called phlebitis. And the longer the blood sits in a vein, it can cause a clot. So that's thrombophlebitis. In advanced times or advanced issues with this, if the phlebitis is long-standing, it's almost like a domino effect, where the superficial veins become affected with this clot, and then eventually they can go into the deep veins and cause a deep clot. Usually patients are aware of it before that happens. As well, open wounds or ulcers can occur, particularly at the level of the ankle. And again, the reason for that is that the blood sits in the vein, causes irritation, and then eventually itching can ensue. And then the skin breaks open and causes an ulcer.
Okay, a Facebook question for us. What can you do about a vein that's already been cut, that's buried in your calf muscle? Does that make sense?
It's already been cut?
Yeah. So it says that's already cut, that's buried in your calf muscle. Would that make sense, a cut? All right. If you wrote that question, write us again. Sometimes that happens. But yeah, so we'll try to figure out to make that more clear. Another question, though, coming in from Facebook, too, is besides wearing support knee-high stockings, what else can I do to prevent varicose veins from forming or from spider veins getting any worse than behind my knees?
So thank you to that viewer for bringing up compression stockings. Compression stockings are a really important first step that all physicians treating vein disease should offer to patients. And the reason for that is that compression stockings act from the outside to prevent those veins from filling with blood. So generally speaking, if someone comes to me and they say that they have some kind of symptoms that sound like vein disease, but I'm not entirely sure, putting patients in a course of these compression stockings can help tease that out. And if you feel better after wearing them, that helps. As well, there are some people who may have very mild symptoms and may say, I really don't mind wearing the stockings. They make my legs feel great, and even though the procedures nowadays are minimally invasive and short and quick. I don't know if I really need to have it done. The downside about compression stockings is, particularly as we're reaching the Baltimore summer, if they become a little bit hot and cumbersome. And I sort of compare them to eyeglasses. So certainly when you put your glasses on, you can see beautifully, and then they come off and you don't, and that can certainly happen with the stockings.
Does this usually start at a certain age for some women? I mean, can somebody of any age have these issues?
Yes, they certainly can. I would say they tend to start in the mid to late 20s.
Okay.
And then they certainly will become more plentiful as we age.
Somebody wrote in, what makes varicose veins look raised at times, and what is the best way to get rid of them?
So the raising of the varicose veins has to do, or the bulging that we see, if you run your hand over your leg and you can actually feel that vein, that has to do again with the blood sitting inside the vein and eventually coming out and going into the rest of the circulation. But that will just distend it. That blood sitting in the vein will distend it and fill it. And over time, they will tend to get larger. And we certainly do have minimally invasive ways to remove those bumpy veins.
Can running cause vascular issues?
Running cannot cause venous issues. In fact, a lot of my patients who run, who have gigantic, ropey, varicose veins, say they don't have any symptoms. And again, that points to the fact that they're really activating that calf muscle pump, and they're making their legs really circulate a lot better.
Okay. All right, we had that viewer write in again, so hopefully we get it this time for
Thank you.
Okay, so she broke her leg, had pins in it, the vein got damaged, and then it got wrapped around the length in her ankle. Did we clear that up? Do we need you to write it in again one more time? Let's write it in again one more time. Okay, we're having some issues understanding, and we want to get to the bottom of this. So just write it in on Facebook again for us, Kesha, because we want to try to answer this question for you. All right, another Facebook question coming in. What is the first sign of vein damage?
The symptoms actually are the most important. You don't necessarily need to see visible varicose veins. There are main superficial veins in your legs as well as the deep veins that can cause symptoms. So you may feel this heaviness, swelling of the legs, fatigue of the legs, particularly when you're standing or sitting for long periods of time. And that would give you possible clues that there may be vein issues going on in your legs.
Okay, can you really get relief from veins that are itchy?
Yes, you absolutely can. That tends to be one of the indications for intervention usually, because the more one itches, the more possibility it is that could develop into an open wound or an ulcer.
Okay, and for some of these specific questions, is it best just to write in and have those answered or go in and see a specialist? Because we want to keep these a little bit more general, because obviously they should be going to their personal doctor, right, for personal care.
Sure, absolutely. I do agree with that.
Okay, and so the best way to see a specialist, should you go to your primary care physician who refers you to someone like yourself? Is that the best way to go about it?
Yep, I think that would be the best thing to do, certainly, because there are a lot of choices out there, and your primary care doctor, I say this to my patients a lot, or your internist, they're really your gatekeeper, and they know you best, and they will have a lot of important relationships with their own set of specialists who they've seen good results with. So it's good to touch base with them.
Gotcha. Okay, another question coming in for us. Both my grandfather and my mother have very dense spider veins on their feet and ankles, so dense that their feet turn purple. I am beginning to develop spider veins also on the inside of my ankle and on the outside of my ankle. I wonder, is there anything I can do to prevent it from getting as bad as theirs?
Unfortunately, they're not, and it is true that you can really develop purpley feet from very dense spider veins. The spider veins in and of themselves are not what we call physiologically significant, which means they're not dangerous to you. They're just not visually appealing. We do have certain treatments for spider veins. They are considered cosmetic unless they cause bleeding or other medical problems.
Okay. Someone wrote in on Facebook, can veins be repaired after numerous IV punctures, like scar tissue or valve damage?
They actually don't need to be. Veins that occur, veins that are possibly injured from multiple IV punctures usually occur in the arms, and we don't operate on them. The arm veins have a very different anatomic distribution than the legs, and they tend to recover nicely.
Okay, I experience pain and range of motion. My range of motion has been affected. The swelling has subsided, but now I have an achy pain, almost feels like a strain or pull behind my knee. Should I be concerned about a possible clot?
The way to diagnose a clot or a deep vein thrombosis is with an ultrasound. That is a non-invasive, simple method to detect whether or not someone has a clot. And if you are experiencing any kind of leg pain like you're describing, you absolutely should get that evaluated sooner rather than later.
Okay. My friend has a severe case of blood clots. They burned some veins that were damaged and caused pain. They have also put in balloons and stents, continue to clog. Is there anything else he can try or have done?
Well, most likely, to be frank with you, it's going to be a little hard for me to answer the question. However, a lot of the times what can happen is that if the deep veins are affected, which is what it sounds like in your in this friend's instance, there tends to be a lot of support with compression stockings, which tends to be more important. The problem with the veins, and also the good thing about the veins, is that the more we tend to treat or remove, the more veins that can develop. So sometimes a little bit less in those instances is more. And it certainly also sounds like this person requires a hematologist or a blood doctor to evaluate that from a medical perspective.
Okay. Another question that came in for us. I have a very large varicose vein in my leg that runs from the top of my thigh down around my knee to my ankle. It hurts a tiny bit, but it's super ugly. And my leg is always swollen, especially at the end of the day. I have 4 children. I'm done having kids as of 1 year ago. I have had it for almost 2 years. So my question is, what will happen if I keep putting off surgery, and what kind of surgery would I possibly need for this?
Excuse me, in order to define precisely what surgery would be best for you, we would need to start with an ultrasound. The ultrasound test that we just touched on earlier has to evaluate the blood clots, the presence of blood clots, but actually the test that you would need would be something called a reflux exam, and it would involve ultrasound techniques that we would do to see whether or not the veins in your legs, those valves themselves, are actually working. And then that would be able to give us a better idea. This viewer did bring up a really great point about when to proceed with possible vein procedures or surgery, and when to do it with respect to having children. And the data is still out on that. At GBMC, we're actually just starting. We received national funding from the American College of Phlebology to start a research study to determine when to intervene and do compression stockings help slow the progress of venous disease during pregnancy. So if you are a patient who's currently pregnant and you would like to enroll in the study, we'd be happy to have you on board. In your case, if you finished having children, that's for sure the best time to do it.
If you have varicose veins and you just hate the way they look, it's a cosmetic thing, can you go in and still get a procedure done? And then also, would insurance cover that?
Excuse me. For spider veins, insurance would not cover it, but we absolutely could do it. It's low risk. You walk in, you walk out. And the procedure is called injection sclerotherapy, where we inject sclerosant or a liquid into your spider veins, and you get a nice result. Not very durable, but it tends to look nice for a period of several months to several years, depending on the patient. And for bulging veins, I would recommend coming in to be evaluated.
Okay. We had somebody write in that she has very painful bulging veins in her leg. She went to another hospital. They did not do anything to help fix it. Could she get a second opinion? And so I guess for other people, do you recommend getting a second opinion in this case?
I absolutely do. I would say at least 30% of my new patients are second opinions. And I think that's extremely bright, because what I tell my patients very frequently is that physicians and all of us in the medical profession, we're in a service profession. And if you don't feel comfortable, or you feel vulnerable, or something doesn't feel right, you should always go ahead and seek a second opinion.
Okay, we have another question that came in. I receive IVIG, does that make sense? IVIG
yes.
treatments, and I'm trying to avoid a permanent port. Most of my veins are blocked by scar tissue. Will they recover? And does the scar tissue ever break up and create a stroke risk?
The scar tissue does not create a stroke risk. The clot tends to create a stroke risk, and there isn't really effective surgery for that. However, should those veins where you need your port for your IVIG become blocked over time, there are minimally invasive procedures that predominantly radiologists do, but also vascular surgeons, where we can actually go inside the vein and put dye on to see how blocked the vein is, and then potentially put little structures in that are similar to opening up an umbrella to relieve that pressure. And I hope you're almost done with your IVIG.
Another question that came in, what is the first sign of vein damage? And does numbness occur where damage is or somewhere else in the body?
When veins get damaged, these vein valves get disrupted. They're not, I wouldn't even go so far as to say they're damaged. They're just really merely working inefficiently, which is why not everyone with varicose veins or vein reflux requires a definitive intervention. The itching is, the fancy term for that is called venous neuropathy. And the reason you itch is for two reasons. The first one is because the veins can, when they fill with blood, they sometimes travel with adjacent nerves. And so then the nerves get irritated and you itch. Or as the blood sits in the vein, the blood breaks down and causes an iron deposition or hemosiderin. And that iron causes itching as well.
Just a general question, I mean, have you seen an increase in vein disease over time in your practice?
I think that people tend to be more aware of it. I'm a vascular surgeon, and I started a vein center at Hopkins about 10 years ago now. And I think that, it's true that if you open it, people will come, and so people take a look at it. It's a very easily diagnosable condition, and I think that as people become more aware of it, we're able to prevent more dangerous manifestations of advanced vein disease. So I do think we see more of it, but I think it's because people are thankfully more aware.
More aware, and awareness is key in anything.
Absolutely.
Okay, great. Well, Dr. Jennifer Heller from the Vein Center at GBMC, thank you so much for writing your questions and for chatting with us on Facebook Live. We do this every month, so we hope you will tune in again. And if you have any questions, write in. I know they're great at GBMC. We'll answer them for you on Facebook. So have such a great day, and we will see you back here tomorrow morning at 4:30 for Good Morning Maryland. Have a great day, and thank you.
Thank you.
Okay, we're going to press finish on this.